So the constellation of these things that I've been talking about are called post-trauma vision syndrome. And the most common type of eye teaming problem is called convergence insufficiency, where the two eyes do not converge well to see things up close. As the eyes look at an object coming towards them, one eye will start to turn out, and then that's when they see double vision. It's the most common type. They may have what's called a visual midline shift syndrome, which means that the perception of where the middle of their body is not where the actual middle of their body is. They can perceive that the middle of their body is over maybe to the right, and this is the middle. So I must lean into that middle in order for me to feel like I'm straight. But if you're leaning like this, the physical therapist moves you up straight and you feel like you're falling down because your percept is over here. And the reason why I mention that is that we have optical aids that can shift that percept to be where your perception of midline is the same as actual midline. And it can be an immediate improvement in their ability to walk. You'll see their speech improve. You'll see their posture realign. And I have some videos to show you about that. And we talked about the other things on there. So neuro-optometric visual rehabilitation involves many different tools and therapy. The first thing that we do is we do some diagnostic testing. This is different for every person that comes in, depending on their symptoms and what we find in their examination. They may have some extra specialized diagnostic testing, like the gentleman on the left has some sensor goggles that have sensors that measure how his eyes are moving as he's reading, and we can see on a graph whether they're shaking, they're going too far ahead, they're jumping, skipping lines. All of that is documented, and so that after therapy we can do the same test and measure the difference. The gentleman on the right is having it's called a visual evoke potential, where we put sensors on the back of his head and the front of his head. He's looking at a checkered pattern, and it measures how the brain reacts to the visual information that's being presented. And what we do is that then we use different lenses and sometimes tinted lenses and different types of occlusion on glasses and remeasure those same brain waves. And we can tell what type of lenses are going to be best for that person in improving their symptoms by using this technology. Many times we don't need the technology because just using those lenses, the patients tell us, wow, that's so much better. And so then we can just use that. Now, these are 4 of the big tools that we use as optometrists. The first one in the top left are using different filters. Filters are different type gradations of or colored tints, and each tint has a different effect on vision. In that, in the color spectrum of the rainbow, the red tint is a sympathetic nervous system stimulator, which means it stimulates the fight or flight response. On the blue end, it stimulates the parasympathetic nervous system, which is our rest and relaxation system. So if you're in fight or flight and we want to relax the system and to rest and digest by using a blue filter. So blue is actually one of the most common tinted colors that we use for the treatment of patients with concussion and relieving their symptoms. But the other tints may be used as well. For some of them help with images that help the brain bring together the images when one eye wants to drift up. Some of them help with eyes that want to turn in, but they're a very powerful tool. The type of lens that is on the upper right is called a yoked prism. And a prism is a type of lens that shifts the image of what a person sees when they wear them. So if they put on those glasses, the image of the world would shift over to the left. And so this type of lens works great for those people who have a midline shift, to where the percept of where their midline is shifted over, like I was talking about. We can move basically the image of the world to center them. And so we do different testing to see how the posture and their vision and their processing works with these type of lenses. The bottom left picture is, it's hard to see, but there's a tape that is on the lenses, and it's called binasal occlusion. And what that does is it takes away some of the visual confusion that the patients see, and it's one of those instant relievers of confusion, especially early on in the concussion recovery. And then we use many different types of lenses, and both magnification and minification lenses to help improve the focusing system, to improve their peripheral awareness, and many other utilizations. And this is what's unique to both optometry and ophthalmology, is being able to use these optical tools in rehabilitation. So this is an example of a person who had a concussion, whose depth perception was really affected. And it's a very simple test in that we just have them hold their hand up and try to touch the ball as quickly as they can. And so you'll see with this gentleman in the video how his depth perception was affected. See how far off that is. So when, and I'll show that again. If you can imagine that you think that everything is shifted over that far, why that person would be clumsy and trip and fall and run into things, because everything is shifted off to the one side. For this one, after just a couple sessions where we were working on fixation and being able to tell location of where things are, you can see his ability to touch the ball is much easier. So this one is some of the midline shift testing that we do. So this woman it's a simple test. It's not so simple, but it's simple, where the patient will walk down the hallway, and what I'm looking at is their shoulders. Are they moving their arms back and forth because that's a more fluid system? Are they bracing themselves? Are they have their stance wide to give them stability? Do they have heel to toe movement when they're walking? And how do they feel after they've walked down the corridor here? So with the, what we use then is those prism glasses. And what the prism does is, again, reorganize the space for that particular person. And we do test the prism in different directions to see which one works to make that posture and that movement more fluid.
What does that feel like? Better.
So you can see that even she was moving her head and walking, whereas before it was very like stiff and much more disorienting to her. And so that helps with guiding whether we prescribe prism in glasses or we use different therapy techniques to reestablish where that midline is, or both. So this gentleman had a severe concussion, and when he came to me in the beginning, he had been in a dark room for months because he was hypersensitive to all sensory stimuli, severe pain with his eyes, with his head, and very photophobic or light sensitive. And even getting to our office was a challenge because he had to be in a car on a long drive to get to our office for the evaluation. We were doing testing with just walking down the hallway, and you'll see this is his reaction just to his orientation. And how he has to be grounded to stand against the wall because everything's so dizzy and moving on him that it's too much for him. This is a video of a different day, but we were trialing some yoked prism for him as well to see if we were going to put that prism in glasses to help him. And we have done some therapy as well, but you can see the difference with his walking here.
Wow, this is great. That's so cool. Yeah, that's weird.
Yeah,
Great.
I like that one the best.
I actually saw the hallway, not just like where I'm trying to look.
And you can see he was explaining exactly what we were talking about, is that he's seeing the whole room rather than just that central focusing that we were talking about. So the other thing with him is that we had seen him about 10 months after his injury, and he wasn't able to read anymore. He couldn't look at a cell phone or a computer or print or anything, and he hadn't read at all. So I was thinking he was doing well with this prism, and so I was challenging him, and I was like, let's put it on tape and see what you think. So this is the first time that he has read since his injury.
Yet, but I just wanted to see how that makes it to where you're trying to decipher words and look at the same time.
Jill likes to play with the animals on her farm. The cow she likes the most is all black. One day she took she took that cow some milk. Two other cows wanted the milk too. The other cows bumped her down. This makes no sense. She called to her mother for help. Her father saw her and ran to help. Now Jill stays away from the cows.
Now go ahead and take off the glasses. See the difference between the two.
Judy has one pet. Her pet is white. Judy feeds her. I keep going in front of it. Judy feeds her pet every day. It does not like dogs or cats. It is not a rabbit or a pig. It plays in the water. Judy has to run very, very fast to catch her pet. She keeps her pet in a cage. Can you guess what animal Judy has for a pet? She has a pet duck.
What does it feel like, the difference between the two with the lens versus without it?
Oh, it feels horrible. I can without the lens, I can feel my eyes jumping forward and then also up. My comprehension is way down, and it's more uncomfortable to read.
So we were coming out of our skin super excited that he was just reading, and so was he. So this was great to get on video, and he's now working more with doing reading and on a computer screen now.
Read, yeah.
So what we do to stimulate the central vision along with the peripheral vision simultaneous is that we do an eye movement activity along with a balance activity. Remember, our periphery tells us where our body is in space, and so if we have a patient where they have to tell where their body is in space, that's stimulating the peripheral vision. and then while they're doing a tracking and trying to keep their posture while they're tracking. So this gentleman is in a wheelchair, and he's not able to be standing to do any kind of balance activities. So we have him sit on this type of cushion that kind of wobbles. So he gets a feedback of where his body is, and he's looking at a marble that is going in that 8 position, and he's having to move this in the marble and track the marble going around in an 8 position. Now I want to do a little activity with you, to those in the audience, and this is one of the activities that we do that has a cognitive demand as well as an eye movement demand. So the first thing I want you to do is first look at the green dot, now shift to the red, then green, red, green, red, and that was pretty good, right? So now I'm going to tell you to do the opposite of what I say. So when I say green, I want you to look at the red dot. And when I say red, I want you to look at the green dot. Are you ready? So green, red, green, red, red, green, green, red. How many people had difficulty with that? Yeah. Because we think, oh, eye movements, not so hard, but they are hard when you have to do something else at the same time, to where you're having to think and have balance and do an eye movement all at the same time. So here's a gentleman who has a visual field loss. Remember I talked to the 3 types of visual field problems. So he has difficulty with with one side of his vision. So we have him doing this activity where he's pressing a light on a board, and it goes in time, and whenever he presses it, there's a new light. So he has to be aware of his central vision and his peripheral, and being able to switch back and forth between his 2 arms to push the button. And the reason why alternating the arms is important is because it's stimulating each side of the brain every time he alternates with his hands. And we also have him on a balance board, and that is so that he's aware of his periphery while doing this central task. Let me show you this. And he's doing very well with this. He's had a few sessions with us, and when he first started, he couldn't find any of the lights flashing on one side of the board, and now he's able to search and find the lights. So he's doing very well. Sorry. So accommodation, that's another word for focusing, and not the pay attention type focus, but the focusing of making things clear and single. So what we use is those different lenses, and a minification lens and magnification lens relaxes the eyes and then constricts the eyes, relaxes and constricts. So it's a therapy tool in order to train that lens to be more flexible and have less of a spasm. So this woman is holding a little chart of small letters, and pretty close. She's looking through one side of the lens to where her eyes have to relax to make those letters clear. And then she switches the lens, and now she has to constrict or try hard to make it clear. And then we're flipping back and forth, so it's getting that flexibility back. But we're also doing this with movement of her periphery, where she has to maintain her balance while she's in movement, because she also has symptoms of that visual motion sensitivity. Whenever things are moving, then she gets nauseous. So she's moved up to this activity. We start with her first sitting and doing just the flippers, and then we get it to where she's standing, and then now in a moving situation. So we have her on a swing.
A-O.
How's the movement?
Okay. Z-R. E-H. F-B. A-B.
In this activity, she's sitting, but what she's doing is that she has special filters on. And the filter, she has a red lens over her right eye and a green lens over her left eye, and a magnification lens on one eye and a minification lens on the other eye. And what that means is that when she's looking at these little pictures, only one eye can see it. The other one sees a blank picture. And so she has to focus one way to see the cue with one eye. And then, but the other eye still sees peripherally. And then she's looking at the red screen and there's some pictures on there, and she can only use the left eye in order to see that. So it's also a training tool to test the flexibility of the focusing system and also
Is there one
discrimination.
eye or the other that you feel like you're seeing them better with?
What is this one?
The right one?
Yeah.
And what she's doing is she's matching the pictures that are on the cards to the pictures that are on the that red film. And it's a pretty difficult task, but it makes it to where that improves that flexibility between the eyes and the periphery.